Welcome to the Regen Doc Podcast, powered by dynamicathlete.com. I'm your host, Dr. Aneesh Garg. I'm Yale trained, Andrews trained, and a two-sport U.S. national team doctor here to help you make sense of regenerative medicine. What nobody tells women about their bodies after having kids. Your OB cleared you at 6 weeks and said, see you next year. And then you went back to running, and then something wasn't right. And when you mention it, you were told, this is just what happens after kids. Do Kegels. I want to tell you that answer is not good enough. And we're going to get into it.
I leak every time I run, jump, or sneeze. My doctor says it's normal after kids. Is it really just something I have to accept?
No. Full stop, no. Look, I know you're gonna hear and be like, what does this guy know about having kids and talking about? I'll tell you, we had a lot of our female athletes and even male athletes will come in and male patients and female patients come and ask us and like, what do we do? But specifically here, when your doctor says that's normal after having kids, that's not a good enough answer for me or anyone else in our clinic. Women getting dropped off 6 weeks postpartum with no real plan, to me, is a disservice to these women. And so when we first started our clinic, we had nothing to help from a pelvic floor standpoint. And we tried a couple of things and it just didn't work out. We started to look at other options. But the big thing was the more and more people that were asking us, can you help us? Because I have these issues. The more we started to realize, I didn't realize it was such a big issue until we started doing more homework on it. That wasn't a major focus of our practice. But you start to realize the gap that these, and we're talking about postpartum women, that these women fall into. And I think it's a disservice. And that's why we made a change in our clinic to be able to do something really, really great for these women. The gap between your OB clearance and actually feeling like yourself again can be years or actually never even attainable. So nobody owns that space. That's 6 weeks postpartum. And you can say, well, okay, they sent me to pelvic floor PT. Pelvic floor PT is super invasive. Some people aren't comfortable with it. Some people don't want to do it. I don't blame them. I'm not saying it doesn't work and that doesn't have a place for it. But there are other options out there for people that are struggling with this. So if you are leaking every time you run or cough or jump or play with your kids or watch your favorite movie or show, and you know this part's coming up that you love and you're going to laugh really hard, but you know what's coming after that, this is for you.
So I've been doing Kegels for 2 years and nothing has changed. Am I doing them wrong or do they just not work?
Yeah, I think Kegels work if you're activating the right muscles correctly. And most people aren't doing it. I think it's really hard to do those on a consistent basis. And it's also not just Kegels in your pelvic floor. You start to look at some of the other components on the abdominal wall. You start to look at the pelvic floor in combination. What about hip exercises? What about low back? I think this is sort of what you get into in how do you take care of people in totality. And then in more severe cases, just doing Kegels is not enough. So it's a matter of how do you go after what's actually some of the problems here. So you can look at things that can help strengthen that pelvic floor in a way that you can't do by yourself. I think even from a pelvic floor PT standpoint, I think, in our office, we use the Emsella chair, which is a high intensity electromagnetic frequency device that strengthens your pelvic floor in a way where you sit on a chair and this magnetic field helps stimulate your pelvic floor and helps it to get stronger. That's what we do at Dynamic Athlete. And so we couple that with Focus Shockwave, and we've created our Dynamic Core Plus program. And the whole premise behind that is, how do we attack this pelvic floor issue in a way that doesn't exist? So to me, that's a really big component that is neglected. And if you're driving in your car or you're home or you're at work or whatever, and you're looking and you're listening to this and you go, you know, that's me. I have that issue and I don't know what to do. I would tell you to go to dynamicathlete.com and go read about our Dynamic Core Plus protocol and what that entails and how you can get better. And we're not even talking about the sports and athletic performance component of this. We're simply just talking about increased abdominal pressure causing leaking because of weakness in the pelvic floor after birth. That's one subset. There are other subsets that people fall into. This is not just a female problem. And I think that's the other thing too with this, is that there are men that have a lot of times a hypertonic and overactive pelvic floor. And we take care of those and they do really well with that. There are athletes that are looking for the competitive advantage. For those of you that heard the ExoMind podcast, this is the other part of the competitive advantage, is our Dynamic Core Plus in combination with the Dynamic Mind Plus protocols. If you get to work on your pelvic floor, which is super neglected, hockey players, soccer players, a lot of people that are using that pelvic floor from a power standpoint, this can make a huge difference. Even runners, especially runners, I should say, especially runners and triathletes and cyclists. We're going to have a lot of examples in terms of where these athletes say they feel stronger through their stride, through their skates, through their pedals, after they've gone through these programs, because you're essentially creating another strength point for somebody that has had weakness and they didn't even know it. So that's, to me, where it can make a huge difference. So if you're having some of these, I think the big thing for me here is you're not alone. That's one. And number two, there's options for you. So I don't want you to despair and say, well, this is now my life. I'm just going to be leaking every time I have increased pressure, or it gives me pause to play with my kids because I'm going to have this issue. A, it's nothing to be embarrassed about. B, there's something that can be done about it. So if you're sitting in your car, I'm telling you that you're not alone and there's something that can be done about it. So fear not, as they say.
Can you tell me what's actually going on with my pelvic floor that Kegels can't fix? Explain it to me like I'm not a doctor.
Yeah, there's weakness, right? So there's a neuromuscular problem. And so what does that mean? There's a connection point where if you've had trauma, and I use this in a way where having kids is a very traumatic experience for the body. I can't say from personal experience, but this is what I've been told. But again, right, you see this with a lot of females. And just inherently, look at what the body goes through to birth a baby. It's magical and insane at the same time to me. And I think, how do you support the women that are producing children in a way where they can reclaim who they were prior to it? So I think that's the drive in the sense of, okay, here's the problem, and then what are we doing to fix it? So it's just not only that your pelvic floor has been weakened by this, it's now not firing correctly. So it's almost a reintroduction of how to fire and contract those muscles and to be able to utilize those muscles in a way where it gives you that support that you need. So we use this chair in our office. And again, same thing. You guys heard the Shockwave podcast. Not all Shockwave's the same. So be careful about these knockoff pelvic floor chairs and things like that. And so I think just things to be careful about. Again, if they suit you, great. But if you're having issues with it, then certainly look into some of the things that are higher grade. It's a connection between your mind and your pelvic floor to help you retrain. Think of this as a neuromuscular stimulator that targets your pelvic floor in a way that you can't do by yourself. The chair talks about over 10, 11,000 supramaximal Kegel contractions, where you are maximizing that contraction strength to the point where there's nothing else out there that's like it. So not only are you strengthening it, but you're also retraining your body on how to do it properly.
I don't really understand supramaximal. Can you explain that?
So imagine like your computer that's running at 100% capacity. If you're doing Kegels by yourself, your equivalent is like you're only, say 20% of your computer function. The supramaximal, meaning the maximum that you can do, is running at 100%. When they talk about giving 110% effort, that's impossible. But I understand the sentiment. So it's kind of the same way here, where you are trying to override that system in a way that's more powerful than you can do by yourself. And so, yeah, that's a good question. That's a good clarification. That's what I mean by that. You need assistance to get to that level. Pelvic floor PT is really good for a lot of different things. They can't do that. Nobody can. And you can't do that on your own. And that's where you need help. And then on top of that is how we utilize our focused Shockwave machine in a way that's actually going to help your entire core be activated. We have people come in and say, it feels like I've done a deep ab workout and you've now woken up things that I didn't even know I had. So then you can imagine when they go out and run, now they've got a strong foundation. And so if we can prevent people from coming in with SI tears or hip issues or stress reactions or stress fractures because they don't have the strength, that's what this is designed for. And I think that's the component. Like we've had women that have had pelvic stress fractures because they're tall, thin, athletic, had a kid, didn't know what to do, just went right back into running with no support. And then they come in, they go, my hip hurts. And then I ask them what they did. And they go, what do you mean? What did I do? I saw my OB-GYN. They said 6 weeks. We're good. Have fun with your baby. Right? So that's the gap. That's where people are in this abyss. And I think that's where the people get trapped. And I think that's where we're making a really huge impact in that regard. So, I think I go back to the same thing I said before. Just go to dynamicathlete.com, read about it, educate yourself about it, because there's options for you.
Can you tell me an example of a woman who stopped running, stopped jumping with her kids, stopped living her life, and then got it back? What did that look like?
Boy, it's hard to pick just one. I think that's where the one that really just sticks out. It's tough to translate over a podcast or even on video and or whatever, because it's the look that they had, where when we first had them, there was this sort of despair and slight sheepish shame feeling. And then afterward, you could see the vibrant nature, and it's almost like when somebody gets a color back in their face after being really like sick or whatever. And so she shut herself off to the outside world. She didn't want to deal with it. So she's staying at home. There's some element of postpartum depression there too, which we take care of from an Examind standpoint in the office and do that. But there's, you have that component, and you start to look and you go, this woman's in her house and she's not living the life that she wants to be able to live because of something that is controllable. And there are things there that can help her. And then, so she's spending money on pads. She's spending money on new underwear. She's spending all this money on things that to just manage her symptoms versus actually taking care of the problem. And I think that's the hardest part. And when we started to do work on her and she noticed a difference and she started working out and she was able to go back to the gym and to have her interactions with her friends at the gym, it's life altering. Forget the fact that she stopped leaking. That in itself is a win right there. But the relief and the social interactions are what brought her back to life pretty much. And I think that's the cool part for me. I think at the end of the day, when you get your people back to doing what they want to do, that's the cool part. That's the fun part for me. That's why we do what we do. It's more about how do you create that connection and you see your people getting back, and it's one of the best things I can tell you. So, I think the emotional toll, the identity loss, the embarrassment, the frustration. This is a postpartum athlete that avoided running, any type of social situation, anything that would trigger her leaking. She shut down. And I think how does that affect your relationship with your kids? How does that affect your relationship with your family? And you start to make these changes by just taking care of somebody's pelvic floor and their core. And now you're affecting change in their life in a way that you couldn't even imagine.
What is dynamic core, and how is it different from just doing more Kegels or going to pelvic floor PT?
Yeah, I think part of it is our inclusion of our focus Shockwave and how we target certain muscle groups in that area. And I think that's been a huge game changer. We had somebody who said, "Oh, well, I've been on the Emsella and it didn't work for me, or I've done this and it hasn't worked for me." And we say, yeah, we do things differently. And I think we target different muscle groups, and we try to make sure that we are not just taking care of the pelvic floor, but also addressing your core in totality, which again, we talked about in the open, where it's your abdominal wall. How do you take care of making sure you're addressing your hips and your glute strength, and how are you affecting your low back? All these things combined, you start to look at what the process is and what's that interplay in terms of what you're doing. And I think that makes a big difference. So that's how we make a big difference in terms of our protocols and how we take care of it, but again, we're trying to go after what the cause is. And so if you look at pelvic floor PT, and I think pelvic floor PT is a good option. I'm not saying anything about that. I think there's a choice though. Pelvic floor PT is a very invasive process. What we're talking about here is the least invasive pelvic floor recovery program there is. And that's where the big component is you're fully clothed. In pelvic floor PT, guess what you're not? You are not fully clothed. So there's a big difference there. And I think, you know, if you're struggling with this is a pretty good place to start in terms of from a treatment standpoint. And especially we jump on it early, 6 weeks postpartum, get you back. Part of the Shockwave that we end up doing is helpful from a C-section scar too. So that's another thing to consider. But go on dynamicathlete.com, read about it, get yourself educated, ask questions, and we'll see you next time.